we have Dr. Jibran with us today. So, Doctor, can you tell me how do you start off your career in this and how do you pursue into dentistry?
Yeah, okay. So dentistry, I never wanted to be a dentist. I never wanted to be a doctor actually. I wanted to be a pilot.
Oh.
But then my mom convinced me saying that it's a driver's job. So do you want to be a chauffeur? I mean, solely on the time, obviously, 10th standard group selection. Then she convinced me that, being a doctor is good. We need it in the family and everything. Fulla solli. They motivated me to be a doctor. And I said, doctor I cannot do because I have to study a lot. Then she said, okay, then you become a dentist. Then you don't need to study a lot. But dentist, not only about studying, but we used to have a lot of practical work also. For medical, lots of studying obviously is there. But in dentistry, every field we have to do handwork, practical work on patients. And that was a little more stressful than just studying. So anyways, so that was the journey of getting into dentistry. Obviously didn't have much interest and everything. Only after I finished my undergraduation I started liking dentistry. Okay. And then a real passion came in for my field, which is anything artificial in the mouth. I do, that is prosthodontics, implants. So adu was giving me a very positive because I used to get results immediately. Like there are many fields in dentistry which deals with multiple treatments and everything. So in my field, the results I can see immediately. The patient is coming in with a problem of a broken tooth. I can fix the tooth in 2 days and give him a new, tooth. Same thing goes for a smile correction. When you do orthodontics, braces potu or smile correct pannona, it takes years together. We'll be able to do it in a period of say 2-3 days.
2-3 days.
So the whole body language of the patient, whole confidence of the patient, it just boosts up overnight. Yeah. So that gives a lot of inspiration and motivation, that can change and impact a person's life. So that is how I started loving dentistry.
So you fell in love more of the smile of that your patients were.
Smile, and also that's just one example. Apart from that, so many things. We relieve pain. They come in with pain because most of the patients come in with pain. They come in with a heavy heart, when they are not able to smile properly, talk properly, be social. They come in with that problem, we correct that. Same thing goes for, a general health now. Without teeth, you cannot be fully healthy. So, சாப்பிட முடியாது, மெல்ல முடியாது. So, அதுக்கு நம்ம teeth கொடுப்போம், implant பண்ணுவோம். That also is now all fast. Before and all, we used to wait for months together for the implants to heal. Now we practice much faster dentistry in which within a 3-4 days time, we can give a person who does not have any teeth, fixed teeth. So all that is developing so well now. Worldwide, dentistry is getting to a different level where the time factor, the technology factor is helping us a lot and to achieve results much faster. And obviously much more comfortable. முன்னாடிலாம் ஒரு dental treatmentனா கண்டிப்பா பெயின் இருந்துதான் ஆகும். நீங்க என்ன பண்ணாலுமே. But now there's so much of equipments and support which makes the whole dental treatment a breeze. The full mouth implants and everything is done without any pain for the patient. So anala
cutting edge technology is making it much more.
Yes, it's making it more easy. It's a very important role because whatever treatment that we do, we might do superb treatment and all, but patient is not happy in the chair, there's no use of that treatment. They have to be comfortable, they have to be happy. So even that we are developing and everything. So all these things, I think dentistry is the best field I can be in, no other option. That's the thing.
That's good. So there are two things with what you said, Dr. So everything revolves to one thing. It's like what you intake shows out.
Correct.
And when we spoke also, you said like the first main thing in the body is your teeth.
Correct.
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 So it helps on both on diet or what you consume. How do you go about this? Because what is the most important thing that what you eat, you have to be careful in things.
Yeah. So how it works is the mouth is the gateway to the human body. Everything goes inside through the mouth, majority, So, and the mouth is the place where it requires maximum maintenance. A person, whoever he is, knows they have to brush the teeth.
Yeah.
Correct. But they don't know the importance of the teeth. Brush பண்ணனும் தெரியும், எதுக்கு ஸ்மெல் வரக்கூடாது. But அதை விட பெரிய இம்பார்ட்டன்ஸ் இருக்கு அந்த gums. So whole idea here is because everything goes in through the mouth. That's the area where a lot of bacteria gets accumulated, grows over there if you don't clean properly. ஸோ எவ்ரிடே நம்ம வந்து காலையிலையும் நைட்டும் ப்ரஷ் பண்ணுறது எதுக்குன்னா வாயில் இருக்கிற அந்த பேட் பாக்டீரியாவை குறைக்கிறதுக்கு. And nowadays what's happening is the food that we eat so easily, causing decays and high carbohydrates, starch, it just stucks onto the teeth and it will cause more growth of this bacteria.
Okay.
So the maintenance where before, நம்மளுடைய grandmothersலாம் வந்து வெறும் குச்சி வச்சு க்ளீன் பண்ணலாம், ஏன்னா அவங்க சாப்பிட்ற சாப்பாடு அந்த மாதிரி. The food itself was so organic, it won't be high in carbohydrates, starch or your sugars. ஸோ அப்போ வந்து கூட ஈஸியாக வந்து மெயின்டைன் ஆயிரும், ஏன்னா அவ்வளோ கெடுதி வாயில் போகல, உடம்புக்கும் உள்ள போகல. ஸோ இப்போ வந்து எல்லாமே உங்களுக்கு ப்ராசஸ்ட் ஃபுட்டு, எல்லாமே சேச்சுரேட்டடு. ஸோ தென் இட் அக்யூமுலேட்ஸ் மோர் பிளாக், மோர் ப்ராப்ளம்ஸ். அந்த பிளாக்கு பாக்டீரியானால என்ன ஆகும், more problems to the oral environment. And indirectly nowadays all studies, whatever body of the part of the body you take, everything is connected to the mouth, right from your brain, heart, skin, even your reproductive system, everything has a link to the mouth. So you're never completely healthy unless your mouth is clean and healthy. So what we eat directly impacts the health of our mouth. When you have good food, organic food, nice vegetables, it cleans the teeth by itself. நீங்கள் ஒரு கேரட் கிடைக்கும் போதோ ஆப்பிள் கிடைக்கும் போதோ அதுவே வந்து பல்ல க்ளீன் பண்ணிடும். ஸோ நம்ம வந்து அதே இது வந்து க்ரீம் பிஸ்கெட்ஸும் இந்த ஜங்க் ஃபுட்டும் சாப்பிடும் போது இட் வில் அக்யூமுலேட் மோர் அண்ட் காஸ் மோர் டென்டல் ப்ராப்ளம்ஸ். வாட் வி ஈட் இஸ் த ப்ரையாரிட்டி ஆஃப் ஹவு வெல் யூ ஆர் கோயிங் டு மெயின்டைன், அண்ட் ஆப்வியஸ்லி வி நீட் டு maintain and brush, because that's the gateway of the whole body.
Brush, how does one choose what paste to use and the brushing techniques? So like soft, medium and hard.
Yes,
so
yes.
we have this category.
Yes.
Pal podi powder or paste.
Correct.
So does that shift? Do you have to change in paste like as you age and those things?
Yes.
Can you explain more about that?
Correct. So the oral hygiene starts from once the baby is born and once the teeth start coming out. From that time you have to maintain your oral health. Okay. How we maintain, what type of methods that we use, all that changes and it is applicable to different people. One person will be there, he won't even brush his teeth, he won't have any dental problems. Another person will sit and brush 3 times a day, 4 times a day, still they'll get cavities because people are not common. So same way, same toothbrush or toothpaste will not be applicable for everyone.
Okay.
So in toothpaste there are different varieties, like how you said, toothpaste itself, the components base panni, for a person who's having more decays and cavities, we prescribe that type of a toothpaste. For a person who has gum disease, that type of a toothpaste. For a person who has sensitive teeth, that type of, maybe the enamel is weak or whatever. So the whole idea here is you have to know what is wrong with your teeth. How will you know without visiting a dentist?
True.
Because as far as we know, everything is fine unless we get it checked. So right now your heart health is very good. My heart health is very good according to me. But only if a cardiologist tells me after taking the required test that yes, your heart health is good, then only I can be sure, right? True. So same way, only if a dentist checks your mouth and tell what are the problems you have, what you can expect, like it based on the habits that a person has, what type of food they eat, how they maintain hygiene, adukku thaanda mari the brush and paste. And now brush paste mattum illama there are so many other methods to maintain oral hygiene which is required. Adu vandu maarum, oru person ku maarum. Brushing is not only for the teeth, it is for your gums also. So only when you have a soft bristles brush you can touch your gums and clean. And the toothpaste, anything which is not very abrasive, a normal white toothpaste is more than sufficient. But get it checked and find out what is required. That's going to be helping you in the long run.
Since you said the normal white toothpaste,
your
toothpaste la uppu irukka. What is that fact? Is it true? Like, see, a component of salt on a daily basis, is it healthy?
Yeah. See, what happens is salt is a natural anti-germicide. Okay, it is going to help in reducing the inflammation over there. Okay. So normally you can use salt, but there are so many other components also like that, which is helpful for healing the gums. It's just a branding. It's just a branding to get people something different. No, one year salt will come, next year charcoal will come, next year some turmeric will come. So basic idea here is brushing is important. Paste is like your detergent. You need to wash clothes. Yeah, you can use any detergent, but particularly one particular stain, one detergent works. So even without using a toothpaste, you have to brush your teeth, which is mandatory. Nowadays, there's something called as dry brushing.
Okay.
So even if
I
you
want to ask you, without a paste,
without a paste, without anything, you can brush your teeth. The whole idea here is paste is not mandatory. It is an additional, aid to make the cleanings more easy for you.
Okay.
The main mandatory thing is to remove the plaque, remove the bacteria from your teeth. அது வந்து நம்ம எப்படி வேணா பண்ணலாம், கையால கூட பண்ணலாம் பிரஷ் இல்லைன்னா. பட் எவ்வளோ எஃபெக்டிவாக பண்ணுறோங்கிறதுக்கு வந்து அடிஷ்னல் நீங்கள் வந்து இப்போ அதுக்கு தகுந்த மாதிரி உள்ள ப்ரஷ் யூஸ் பண்ணுறீங்கன்னா இன்னும் பெட்டராக இருக்கும். ஃப்ளாஸ் யூஸ் பண்ணிங்கன்னா பிட்வீன் த டீத்தும் க்ளீன் பண்ணலாம். ஸோ ஃப்ளாஸ் யூஸ் பண்ணாமல் நம்ம 40% ஆஃப் த டீத்தை நம்ம க்ளீனே பண்ணுறதில்ல. ஸோ ஒன்லி இஃப் யூ ஃப்ளாஸ் பிட்வீன் யோர் டீத் யூர் ஆக்சுவலி ரிமூவிங் ஆல் தோஸ் பேட் பேக்டீரியா. Paste just an adjunct. It's just going to help to make the process more easy. It's not mandatory to even use toothpaste.
Like in India, the flossing concept is not that.
Correct.
Yeah, it's not that than the US.
Yeah.
How important is flossing?
Yeah.
What, like on a daily basis, how important do you have to floss?
Yeah.
Like the interval times or like the daily.
So basic idea here is brushing is going to clean the teeth surface on top of the gums, but bristles will not reach between the teeth.
Okay.
For us, every tooth is different. We have 28 teeth, some people have 32 teeth. Between the teeth also, we have to clean. So when we rinse our mouth, it doesn't go between the teeth so well. Just a little bit goes the water or the mouthwash also, it goes. But physical cleaning will happen only with a floss. ஸோ யூஸ்வலி இங்கே நம்ம ஊரில் என்ன கான்செப்ட்னா அந்த ஃப்ளாஸ் யூஸ் பண்ணால் கேப்ஸ் பெருசாகிடும் அப்படின்றது தான் ஜென்ரலாக வந்துட்டு தே அவாய்ட் யூஸிங் த திங். பட் ஆக்சுவலாக இன் த லாங் ரன் இஃப் யூ டோன்ட் ஃப்ளாஸ் ஒன்லி யூ வில் ஸ்டார்ட் கெட்டிங் கம் ப்ராப்ளம்ஸ், யூ வில் ஸ்டார்ட் கெட்டிங் டீகே பிட்வீன் த டீத், யூ வில் ஸ்டார்ட் கெட்டிங் கேப்ஸ் பிட்வீன் த டீத் விச் வில் இன்க்ரீஸ். ஸோ கிளீனிங் பிட்வீன் த டீத் யூஸிங் அ ஃப்ளாஸ் will not make gaps to increase. அந்த ஃப்ளாஸ் வந்து கரெக்டாக யூஸ் பண்ணணும். எப்படி நான் ப்ரஷ் கரெக்டாக அந்த ஒரு பேஷண்ட்டுக்கு தகுந்த மாதிரி நம்ம ப்ரிஸ்கிரைப் பண்ணுறோமோ அதே மாதிரி ஃப்ளாஸ்லேயும் டிஃப்ரெண்ட் திக்னஸ் இருக்குது, டிஃப்ரெண்ட் மெட்டீரியல்ஸ் இருக்குது. ஒரு பர்சனுக்கு வந்து டைட் கான்டாக்ட் இருக்குன்னா ரொம்ப தின்னான ஃப்ளாஸ் தான் யூஸ் பண்ணணும், அவங்க திக்கான ஃப்ளாஸ் யூஸ் பண்ணக்கூடாது. ஸோ அந்த மாதிரி ஒரு பேஷண்ட்டுக்கும் வந்து தகுந்த மாதிரி அந்த பிட்வீன் த டீத்தும் சரி அந்த பல்லை சுற்றியும் நம்ம க்ளீன் பண்ணணும், அதுதான் ப்ரையாரிட்டி. So what type of floss to use? Again, only if we check your teeth,
okay, we
can come to know. So adu vandittu only your dentist should tell you.
About aerated drinks, how harmful it is, because you see drinks where they use toilet cleaners and all that stuff. How harmful is aerated drinks for our teeth as well?
Yeah, so basically it causes a acidic environment in the mouth.
Okay.
So நம்ம mouth வந்து ஒரு neutral pH ல இருந்துச்சுன்னா it is good for the enamel, it is good for the gums. ஸோ ஒரு அசிடிக் என்விரான்மெண்ட்டில் ஒரு டூத் டிகே ரொம்ப ஃபாஸ்ட்டாக வந்து ப்ராக்ரெஸ் ஆகும், கம் டிசீஸ் ரொம்ப ஃபாஸ்ட்டாக ப்ராக்ரெஸ் ஆகும். ஸோ கீப்பிங் யுவர் மவுத் நியூட்ரல், இட் இஸ் டெஃபினெட்லி அச்சீவபிள் பை வாட் யூ ஈட் அண்ட் ட்ரிங்க் அண்ட் ஹேவிங் லாட்ஸ் ஆஃப் வாட்டர் கன்சம்ஷன். ஈவன் இஃப் பை சான்ஸ் யூ ஹேவிங் அ அசிடிக் ட்ரிங்க், அதாவது ஒரு ஏரேட்டட் ட்ரிங்க்கோ இல்லை ஒரு காஃபியோ குடிக்கிறீங்க, இட் இஸ் அசிடிக், இம்மீடியட்லி யூஸ் வாட்டர் டு ரின்ஸ் யுவர் மவுத், மேக் இட் as soon as possible neutral. And if you're having an aerated drink, don't sip on it for a long time. Again, it makes the environment more acidic. And obviously all these aerated drinks have high sugar content and we don't floss. So but the liquid goes between the teeth, it stays there. Yeah, so that's how your tooth cavity is.
And that's where floss also comes in a major role.
Yes, everything is connected. If you're maintaining well, once in a while you can have a soda, no problem. But the whole idea here is nobody does the flossing. Yeah, so they think it's more harmful. Yeah, but in the long run, it is going to help them.
Coffee consumers are bored. Is there any change which happens in the gums or the way of your colors, the darkening of coffee and tea? Does that really happen? Is that someone has to be like, they have to be aware of those things?
Yeah. So what happens is tea layum sari, coffee layum sari, tannins nu irukum. And the tannins தான் வந்து பல்ல ஸ்டெயின் பண்ணும்.
Okay.
Yeah, so அந்த டேனன்ஸ் வந்து டீல வந்து இன்னும் ஜாஸ்தி இருக்குது காஃபியை விட. அதையும் பர்டிகுலராக வந்து க்ரீன் டீயில் பார்த்தீங்கன்னா மேக்ஸிமம் டேனன்ஸ் இருக்குது. Yeah, so when we have tea or coffee, it first of all makes it a little acidic, the mouth. So don't have the coffee tea for a long time. ஏன்னா இப்போ எல்லாம் ஒரு பெரிய மக் எடுத்துகிட்டு ஃபுல் டே சிப் பண்ணிகிட்டே இருக்காங்க. ஸோ அது வந்து மோர் acidic, more problems. Next is, if you're having coffee, try to consume as soon as possible and rinse your mouth immediately. Just with plain water, drinking water, rinse, and you can drink the water also, no problem. So adala vandu limit it. If you can't limit it, at least practice, rinsing your mouth immediately afterwards. And one bad thing to do is have coffee and go brush your teeth. Early morning what they do, they have coffee first without brushing and then they go brush their teeth. So what happens is coffee குடிச்ச உடனே mouth வந்து acidic ஆயிடுச்சு. அந்த 20 minutes பீரியடுக்கு அசிடிக்காக தான் இருக்கும் காஃபி முடிச்சதுக்கப்புறம். அந்த டைம்லேயே நீங்கள் போய் ப்ரஷ் பண்ணிங்கன்னா எனாமெல்லாம் தேஞ்சு போயிடும். ஏன்னா அசிடிக் என்விரான்மெண்ட்டில் ப்ரஷ்ஷையும் வந்து ஃபிசிக்கலாக வச்சு நம்ம பண்ணும்போது தி எனாமல் பிகம்ஸ் மோர் வீக்கர் அண்ட் வீக்கர் அண்ட் த மோர் வீக்கர் இட் பிகம்ஸ் த டீத் பிகம் மோர் டார்க்கர் அண்ட் ஆல்சோ த காஃபியில் இருக்கிற அந்த டேனன்ஸும் வந்துட்டு இட் வில் ஸ்டார்ட் டு ஸ்டெயின் த டீத்.
Because the gum colors, like it always has to be red in Vaga. Is that true, or based on your skin color? Because even I went for a small thing. They said I have two dark things. It's like why is that, doctor? Is that something that I should be alarmed of?
Yeah. So basically, the gum's natural color is light pink. It's not red. It's light pink. But based on the melanin pigmentations that every person has, that only determines the skin color. Even the gums can have melanin pigmentation. அந்த மெலனின் பிக்மெண்டேஷன்னால அந்த பிங்க் கலரில் கொஞ்சம் டார்க் ப்ரௌனு, லைட் ப்ரௌனு, இல்லை லைட் பிங்க்லேயே வந்து பிளாக் ஸ்பாட்ஸ் மாதிரி மெலனினும் தெரியும். ஸோ கலர் ஹேஸ் நத்திங் டு டூ வித் தி ஹெல்த் ஆஃப் த கம்ஸ். பட் நீங்கள் சொன்ன மாதிரி அந்த ப்ளீடிங், ரெட்டிஷ்னஸ், ஸ்வெல்லிங், ஆல் தோஸ் ஆர் சிம்டம்ஸ் தட் சம்திங் இஸ் ராங் இன் யுவர் கம்ஸ். ஸோ வென் யூ ப்ரஷ் யுவர் டீத் யூ மைட் see a little bit of bleeding. It's just very little சொல்லிட்டு நம்ம வந்து இக்னோர் பண்ணுவோம். But that is wrong. When it's bleeding, the body is actually saying that something is wrong over there. நம்ம ஆட்டோமேட்டிக்காக என்ன பண்ணுவோம், நெக்ஸ்ட் டே ப்ரஷ் பண்ணும்போது அந்த இடத்துல ப்ளீட் ஆகுதுன்னு சொல்லிட்டு அந்த இடத்த விட்டுட்டு மற்ற இடம்லாம் ப்ரஷ் பண்ணுவோம். பட் இட் ஷுட் பி இன் ரிவர்ஸ். அந்த ஏரியாவை தான் நம்ம வந்து க்ளீன் பண்ணணும் ப்ரையாரிட்டியாக. பட் டு அவாய்ட் தட் ப்ளீடிங் எபிசோட் வி ட்ரை நாட் டு க்ளீன் ஓவர் தேர். ஸோ கம்ஸ் வந்து பொறுத்த வரைக்கும் த சிம்டம்ஸ் தட் யூ வில் கெட் will not be like a tooth decay. It will not be like pain. It will not be like, it's a very mild symptoms, but it is more harmful to the general body. Gums is the one which is having a lot of blood supply, and the plaque also accumulates through that, and the bad bacteria can enter the bloodstream through the gums. Yeah, so gums வந்து மெயின்டைன் பண்ணுறதுக்கு தான் அந்த ரெகுலர் ஃபாலோ அப் வித் யுவர் டென்டிஸ்ட் இஸ் மோர் இம்பார்ட்டன்ட், பிகாஸ் யூ வில் நெவர் நோ இஃப் சம்திங் இஸ் ராங் வித் யுவர் கம். Okay, so if a person is absolutely fine, no decays, they are maintaining well, they are flossing, we don't want to see them regularly. Correct. But a person who is not able to do it, we give them instructions, they have a busy lifestyle, they are lazy, they don't want to do, we need to see them more regularly so that the problems don't aggravate and become bigger. So usually வந்துட்டு we have நம்ம clinicல patients வந்து every 3 months follow up இருக்காங்க, and there are certain patients who will come yearly once at least. Yearly once is the bare minimum I think we should meet the dentist.
During the pregnancy time, they said like the hormones are more at that time, and there are gum bleeding which happens as well. And and the plaque and bacteria also, there's a lot of consumption there because of the fetus, and a couple of things react as well. And like how important it is when you come through that motherhood and pregnancy time, how is important they have to take care of their
oral health. Correct. Health. So yes, like how you're saying, during pregnancy time, the hormonal changes in the mother's body, it makes the plaque in the mouth easily cross the barrier and reach the bloodstream. Okay. So on the pregnancy gingivitis in Zolo. So the body's immune system is a little weak during that time because of the hormonal changes. So these bad bacteria through the plaque, they enter the bloodstream, they cause inflammation, infections in the gums. And if your plaque is not maintained well, through the bloodstream it can go and settle down anywhere, including the uterus. Okay. It can go up to the uterus, it can even cause preterm births. Okay. So on the preterm birth kuda, with the poor oral hygiene, it is a proven thing. Yeah, so what we have to do once you know that the patient is pregnant, oral hygiene நம்ம எப்படி அவங்க ப்ராக்டிஸ் பண்ணுறாங்களோ we ask them to improve, and additionally வந்துட்டு கூட வந்து அந்த plaque மெயின்டைன் பண்ணுறதுக்கு they have to take some steps. So first it all starts with your dental visit தான். நம்ம வந்து ஒரு பேஷண்ட் எப்படி இருக்காங்களோ அது அந்த மாதிரி we suggest certain things. There are particular new equipments which are there in the market to make the oral hygiene much better, like a water flosser இருக்கு. So அதை யூஸ் பண்ணலாம், that cleans off the teeth. So like that we give them some tips to avoid, usually in the pregnancy time, the gums the weak they start having a lot of sugary foods. The cravings will be there. Yeah. We have to alternate with good foods. Then morning nausea will be there. Nausea appo vomit பண்ணுவாங்க. Vomit பண்ண உடனே அந்த டேஸ்ட் இதுவா இருக்கும்னு உடனே போய் brush பண்ணுவாங்க. That is also acidic. Okay. So when you vomit, the loss of acid, immediately when you go brush your teeth, it will lead to sensitivity of the teeth. And then the other more common thing is like with weak gums, once the gum starts receding down, the root surface gets exposed. That also causes sensitivity. So usually our sensitive teeth they think it's only because of a tooth decay or a tooth chip off, but it can happen from the gums being weak also, and which is very common during pregnancy. Okay. So on the gums inflammation continuous irukanaala, it can cause sensitivity of the teeth also. So usually enna பண்ணுவோம்னா pregnancy la second trimester is the most safest. அந்த டைமில் ஒரு டென்டல் கிளீனிங் ஒன்று பண்ணி விட்றோம். ஸோ when we do a cleaning, the bacteria and all those things, the levels come down, and it's much more easier for them to maintain throughout the the third trimester and after pregnancy also.
And during that time of pregnancy, like any oral procedures are best avoided?
Yeah, so any elective treatment we avoid.
Okay.
But anything which causes pain for the patient, like even your gums making them more clean, or if there's a tooth decay, we can even do a root canal. There's no restriction as such. Only thing, the position of the chair and all patient அந்த மாதிரி கம்ஃபர்டபுளாக வைக்கணும். முன்னாடிலாம் வந்து எக்ஸ்ரேஸே எடுக்கக்கூடாது, டென்டல் எக்ஸ்ரேஸ் ஆர் நாட் சேஃப் ஃபார் ப்ரெக்னென்ட் உமன் தான் இருந்துச்சு. பட் இப்போ ரீசெண்டாக வந்துட்டு அமெரிக்கன் டென்டல் அசோசியேஷன் அண்ட் தி obstetrics department, they have combined and said dental x-rays are absolutely safe during pregnancy as long as a protective gear in the lead aprons or thyroid collar is worn. You can do any procedure, no problem. But we preferably don't do elective treatments. Anything which can wait, we'll keep it waiting. But if it is causing pain, it's better to get the treatment done than to keep taking painkillers and antibiotics to subside that pain. So there's no restriction, but the most comfortable time is the second trimester, most safest.
There's something in your home also, they say like, is any problems in your stomach, it reflects immediately on your teeth if you are ulcer. Correct. How is that process? Like what happens in your stomach, it reflects first in your mouth.
Yeah.
How is that process? Like, can you
so
explain?
Mouth is part of your digestive system. Digestion oda first step happens only in the mouth, where you crush the food, and along with the food, your saliva also secretes, and the lining of your mouth, mucosa nu solluvom. Okay. That one and the stomach lining, everything is all relatives mari, cousins mari. So they are all same, texture and everything. So when something happens in the mouth, the acid secretes and everything, it's connected through the esophagus. Yeah. The minute level reaches the mouth and they cause irritation of the gums. If like even ulcers start coming, if it is very acidic environment, even if you have a stomach ulcer, more acidic or indigestion happens, it will cause wear facets in your teeth, because a lot of acidic environment continuously irukumbodhu pallu romba koocham vara aarambichum. Starting of your digestion, if you're going to have good food, regular intervals, neutral pH, it's going to be good not only for your teeth but for your general body also. So andha mari da. So it is definitely connected because it's the same system, and the mucosal lining also is very, very similar.
Turmeric is something which is naturally used like for inflammations or anything. Like turmeric is the first go-to thing.
Correct.
But when it comes to the dental, turmeric gargling is advisable as well. There's some particular chemical which in turmeric which is extract. It's called curacum.
Okay.
Curacum is the exact component to be used for when it comes to oral, not direct turmeric gargling. So what is that exact component?
The only problem is, turmeric is very good. Yeah, it is a natural antiseptic, anti-inflammatory, but it's yellow color, so it stains the tooth.
Okay.
So that's the reason we don't tell to directly use turmeric. And the component is, nowadays everything is derived, and then they have a separate mouthwash or an ointment which has that particular component. We prescribe that so that it doesn't stain the teeth. That's the simple thing.
That's the thing.
Yeah, but it's good.
It's good.
In general, it's good. We have, even in certain colleges and all, they still practice after they finish a gums treatment, like a little wound is there, they'll mix a little bit turmeric and put a pack over there.
Oh.
That and all they still practice. The only thing is, if the teeth,
does that help?
Betadine, yeah, of course. Betadine is antibacterial.
Like every household had a Betadine wash. Is that good, doctor? Like
see, any mouthwash is good only for a period of 2 weeks.
Okay.
More than 2 weeks, you're not supposed to use a mouthwash. If you see the mouthwash bottle, it will be written it kills 99.9% of germs in the mouth, correct? Yeah. So it's not good. You need good bacteria in your mouth. Yeah, it's killing off everything. Yeah. So that's going to again cause an acidic environment in the mouth. Again, your bad bacteria can grow easily in the acidic environment. It weakens your enamel. So there's a new study which has said that, which has found out that regular use of mouthwashes, over-the-counter mouthwashes, is shown to increase the blood pressure of the particular person. So if you're giving mouthwash to your children, start using mouthwash every day, you're actually inducing high blood pressure for the patient. So it is something which you shouldn't use in a regular basis, apart from the dentist is prescribing to you for a problem. Then usually it is only for a period of time, say 2 weeks, 3 weeks maximum. Regularly, you don't need to use any mouthwash.
So toothpaste and mouthwash, it is like totally different. It's not totally like different. A replacement.
No, not at all.
It is not. So mouthwash is not a replacement.
Yeah. Most, I would say, challenging or most unfortunate was when a 19-year-old girl, she was not able to maintain her oral hygiene, and she had to do a lot of these gums corrective procedures. We call it flap surgery, gum surgery, to maintain her gums health. She has already, for past 3-4 years, she's done multiple gum treatments. She's not able to maintain well. She's still having the bad breath, loose teeth in her mouth at that age itself. So then we diagnosed the problem. It was a syndrome which she had, apart from another skin disease, and it's called Papillon-Lefebvre syndrome. So in that particular case, what happens, whatever you do, you'll not be able to maintain oral hygiene at all. So at that point, we had a job of what we had to do is we had to remove all her teeth. Go for multiple implants.
Zero.
At 19 years, we removed all her teeth, the 28 teeth. Wisdom teeth were inside the bone, so we left it off. We removed all the teeth. We went for 12 implants, 6 implants, zygomatic implants, 2 of them, and the lower one also. And we gave her fixed teeth. So now she's, I think, 23 years, 3-4 years. And before I went ahead with the surgery, I contacted my professor, I contacted all the people because I didn't want to make a mistake, obviously, right? Yeah. So it was a very different challenge because at that age losing all the teeth, and touch wood, the patient's family also, they were in a state to understand and accept the treatment that we gave her, because if we didn't do it at that point of time, and the 19 years later, if we didn't remove the teeth, she would have lost her bone also along with the teeth. Then the implants also will not be successful.
I want to talk about the difference between India's medical and the US part of it. Dentistry there in US is very expensive than India.
I think India, not only dental, everything is not cheap. Is available.
Okay.
You have good dentists here with the good materials, and even the same, the materials that we use, like for example, a brand, of dental implant, say, it's an American brand. Okay. Where do you think is cheaper? It's cheaper in India. The same American brand, if you're getting an implant done over there, it will cost you 2 lakhs, 3 lakh rupees. And we do it here for 40,000-50,000 rupees. So it makes a lot of sense for those people, and they have less number of doctors. Getting an appointment will get more time, say even if you have a severe tooth pain, they'll give you medicines. You have to come for the appointment after 1-2 weeks. And then the procedure has to be planned. Even if you want to go take an X-ray, you cannot take an X-ray. Or you have to go for a totally private organization, which is super expensive.
But there are certain people who finish once their MBBS, they want to fly down to the US and to make more extra bucks because it's much more.
So that's how it works. No, see, basically over there, less number of doctors, more requirement is there. What will happen? Doctors will earn more.
True.
Over here, more doctors are there. So requirement is relatively, when compared to that, it's less. So the earning capacity over here as a doctor is going to be less. So the youngsters who want to earn money, they'll go there only because they want to earn money. But if you want to actually practice medicine, I think India is the best place to practice medicine worldwide. So if you'll have the passion for medicine, you will select according to your field and then decide. There will be maybe a very good research center which is not there in India. So if you want to go there for research purposes, if you want to go there for learning something like a super specialization, yes, of course. Like in Japan, I went to learn implant dentistry. Over there, a single implant, if they want to place, they have to do it only in an OT setup, an operation theatre setup. Okay, it's a full sterile environment. Patient is put to sleep and then they do this implant. There are a lot of things that we have to learn in terms of the technology and everything, but general practice, the number of cases that we do, all that in India is much way higher than what you do abroad.
Like here, if you see, like every nook and corner, there is a dental
Yes.
clinic. Is it saturating or is there a need?
Yeah.
Like people are coming in because there's a study where 95% of the Indians have gum problems.
So the basic idea here is people's knowledge about dentistry is getting a little more, well pronounced.
Okay.
So they're starting to care about their teeth. Okay. One good reason for that is aesthetics. Many people want to look good when they smile. Yeah, so that also comes into play. But in general, there are a lot of studies also which link oral health to the general health. Okay. So, and obviously we have a lot of population. Yeah, even the dental clinics, there are different categories in them, in which one particular dental clinic gives only high-end treatment or a particular specialization treatment like orthodontics and braces. And obviously because the knowledge about dentistry, importance of the smile, importance of oral hygiene is slowly, people are understanding it, the need for dentistry is also more. So like that, as long as you're giving good quality treatment, the correct treatment that is required for the patient, that clinic will survive.
So I would like to talk about the bling industry, like diamonds and gold implants and all that.
Yeah.
How do you see that, doctor?
It's totally the trend, what is happening in that particular area. I think in Chennai, it's not so much, but in general, abroad and all, they have these grills, which the rappers and all these things they wear before a show or a video. It just slides on top of your teeth. It has diamonds, it's made of gold, silver, flashy. So many things are there. All this is just for show, just for this thing. But if you abuse that, you will get more dental problems because they go and fit into the teeth. It's preferred not to eat with them, not to drink anything with them. If it is something which is fixed onto the teeth, can cause more problems.
There's any cases would you done one of the bling or cases?
That for Vikram movie for Vijay Sethupathi, I did those 2 gold crowns. So that was for their character. I didn't know that he was like a drug addict in the character. So I first set of, it's like a gold veneer. I don't need to alter the teeth or anything. Just something which was stuck onto the teeth for the shoot. But then after that first schedule of shoot, they came back with a broken gold tooth. I said, what happened? என்ன பண்ணீங்க? அதை போட்டு சாப்பிடலாம் கூடாது. இல்லை சார், அந்த ரோலுக்கு வந்து அது கடிக்கணும் அவரு அப்படின்னு சொல்லிட்டு, so he literally broke them. So then the second set I made, it was more solid. And it worked well. Even during the procedure, he was very humble. Like, whatever is required, you tell me, I'll do. No, or measurement. Then the next time when we met him, he was very friendly and nice experience. Yeah.
So there's always a phobia, doctors people get scared to go to the doctor. How is it when it comes to when you're meeting the first dentist? Your first dentist appointment is scary.
Yeah.
How do you want us to see that perspective? Now, how do you want us to come up with an open mind, or how do you see that?
The fear of the dentist is there throughout the world, and it is. That's why we as dentists are actually changing ourselves to make the whole appointments more easier. Okay. Yeah. So in the past 15 years, if you ask me, the biggest challenge that I have faced as a dentist is this fear only. Okay. It's not about the patient can't afford a treatment, or they know it's required, they can afford it, but still the fear of it, the injections, the whole environment, the drill sound and all those things makes the person to avoid that, dental treatment. If you see, we've based the clinic based on that fear, meaning we want the clinic to be not to be seen as a clinic, but as a environment where it's more subtle, more calm. So all the visual aspects, we try to make it look like not a clinic, and we also have a auditory sound playing, which gives you a depiction that you're not there in a dental clinic, the continuous music or the wave sounds from, and obviously nowadays the treatments that are coming out, the equipments and everything is based for these fearful patients. So right from the injection that we give, now it's digital. Now we have nitrous oxide sedation to calm the patient down before we do the treatment. And even the basic cleaning that you do, it causes a sensitivity, it causes a vibration. All that is fearful for the patient. So now we have a contactless cleaning method where you don't even touch the teeth, but you get your cleaning done. That child, coming into the dental office, if they have a bad experience throughout their life, they will be having a fear for the doctor or a dentist. And even if they have a problem, they will not openly come and tell that they have a problem because of that particular fear.
Understood. So
all that is very important for a child. They have to have a very positive, welcoming experience. So that's where it starts, that fear. Usually it is the first dental appointment that you've gone, and if something has gone wrong which was not comfortable for you, it stays in the mind. Because the first impression is the best impression.
Yeah. No matter how much of awareness as well, even in cinema theaters, the first thing what you see is Nanda Mukesh about oral cancer.
Yeah.
Like, still even now these days, like, people are not getting the seriousness of it.
Correct.
And as a doctor, what do you say, like, people who are smoking, or 10 years down the line from smoking, how does your gum feel or your teeth feel? Would you like to give us a tips and tell them the do's and don'ts?
Yeah. So apart from smoking, chewing tobacco, that is pouching the tobacco, the Hans and all those things,
Cool lip and all
the cool lip. So that is the one which is the most problematic. Immediately, it's basically an irritant to the gums. When you keep it, it irritates the gums. And anything in the body, continuous irritation is there. The body's way of controlling that irritation is to create more cells. That is only cancer cells.
Okay.
So it can irritate the lungs, it can irritate your gums. And once you start smoking, the overall bad bacteria in the mouth increases. The blood supply to your gums will reduce.
Okay.
Yeah, so all this is a very good environment for problems to, increase and cause. So definitely, whatever habit it is high time that they have to stop it, because we get into the habit for not knowing all these things. And then there's so much of knowledge now here, even including vaping now. They think vaping is better. There are so many sudden deaths because of vaping.
Okay.
Yeah, so it's definitely harmful. More time with it, more studies will come up to say that it is wrong. More common with the youngsters.
As well. What is the danger aspect if they are not seeing, like, every time when you vape? What is the main thing which, like, it directly affects it?
The lungs only. It goes to the lungs and it can cause sudden deaths also. That's what the recent studies have told.
Okay.
So the whole idea here is they are chemicals.
Okay.
Vaping is basically chemicals, and you're putting a lot of chemicals in your body. So wherever these chemicals go in contact, it can cause whatever normal smoking, the gums will react to, the teeth will react to, everything happens with vaping also. On top of it, because it's something which is very new and it can be done anywhere, the rate at which the vaping is done is much higher than a normal smoking.
Okay.
We cannot sit here, normally a smoker will not sit in a closed room and smoke, but a vaping can be done because the smell is not there. So the intensity is higher with vaping.
Alcohol?
With synergistic effect, meaning smoking along with alcohol has a very high irritation rate. Okay. So once you have alcohol, the whole area is the gums and everything is very, very tender. Easily it can get irritated. Now when you smoke on top of alcohol, it causes more problems. Okay. So
the lot of, like, smoking and alcohol creates that dryness in the mouth. Which
it's not only dryness, it's the whole environment is more acidic and more prone to problems.
Okay.
They call it as a synergistic effect along with different components.
Okay.
Causes the chances for oral cancer and oral problems gets more higher.
Okay. What about marijuana smoking as well, doctor?
See, any irritant that also causes the same problem only. See, but with marijuana, the oral cancer, the irritant capability with tobacco is higher than marijuana.
What about this, like, the cultural belief, like, eat cold things after you come out from the doctor, from a dentist thing? What, is that a myth or
no? So basic idea is it depends on the procedure that you're doing with a dentist. Imagine you're going for a tooth cleaning or tooth bleaching, whitening. You want your teeth to be white. If you have cold things afterwards, your teeth will be very sensitive. But the same thing, why we say that cold things is basically to control any inflammations. So that is, if you're doing a procedure which involves surgical, like implant placement or a tooth removal, then blood flow is going to be increased over there, because like whenever a body is healing, the blood goes over there. Like even if you have a fall, that area gets, you know, a little swelled up. So to control the swelling, we ask them to have something cold. And so the bleeding also stops off. So usually for any surgical procedure, it works well. But anything which with aesthetics, like you just got a veneers done, you got a bleaching done, you got your cleaning done, it can aggravate the problem and sensitivity.
Now we are in the festival season now, and the craving is at peak right now.
Yeah.
It's not the right thing to ask him, but even though we have sweets and all, is there something that we can help, or we can
nothing?
Like,
see, its basic idea is you have to have sweets if you are, you know, during a festive season. We cannot control that.
Understood.
Limit that. Okay, the amount of sweets that you have, you can always limit. And good oral hygiene during those times. Like how we said, during pregnancy time, you have to step up your oral hygiene game. During these times also, you should be making sure that your teeth are kept clean. Okay. Yeah, right after you finish your sweets, rinse your mouth. That is one habit that you can develop, which can, you know, save you a lot of time with the dentist and your good earned money. You know, because once you keep rinsing, your food is not going to get accumulated over there. It's going to wash off. The neutral pH is going to come. So it can avoid bigger problems. So right from before diabetes is developed, not having teeth, not chewing your food properly can lead to diabetes. Okay.
Not chewing your food properly.
Not chewing your food properly.
Okay.
You're consuming, because when you chew your food, take your time and chew. Saliva secretes. There's peptides which secretes, the gastric acids that secretes, and there's enough time for insulin to secrete to digest the food. Okay. When you don't chew and you just swallow, the whole food goes inside the thing. There's no salivary peptides, there's no gastric peptides. The insulin secretion also will take some time. So what happens? The blood sugar level spikes up. Number two is, you already have diabetes. The first place, like even if you properly develop diabetes, you have only a borderline diabetes, say. First place it will show is in your gums. Because gums is where a lot of bacteria are already staying, and your blood sugar levels are high. So your bad bacteria is going to grow more and cause a lot of gum inflammation, gum irritation, bad odor. All those are early signs of your diabetes itself. Okay. This is the second level. Next is, you have proper diabetes. Okay. But your diabetes will not get controlled if your gum disease or gum health is not good. Because your body is constantly busy fighting the inflammation and infection in your gums. Now the latest study says that if your gum disease is active, even if you're taking medication for diabetes, the control or the effect of the medication is still reduced as long as your gum disease is active. So it has a very strong connection, diabetes and your gum disease.
Is it normal that when a patient comes to you like above 30,
yeah,
even now 25 and all and above, they
correct,
get diabetes?
Correct.
Is that the first question that a
no,
dentist
yeah,
asks?
it's not a first question, but it's based on the symptoms. Like if you have something which is not healing properly, if the treatment is not working out well, all that can be linked to your diabetes and indirectly your gum health. When diabetes is higher, gum health also becomes poor. Your wound healing capacity becomes poor. So even for a root canal, even for a tooth extraction, your wound healing capacity should be very good for a body to heal. So if your diabetes levels are not so good, then it can affect over there, including your implant success rate, small inflammation, infections in your mouth. All those things can aggravate when your body sugar levels are not good.
Can I have a word of advice for the youngsters now who because everything they are at peak right now.
Yeah.
And as a doctor, what would you advise them for oral health?
Yeah. So for any youngster, the reason why they look towards dentistry is aesthetics.
Okay.
Because they're very concerned about their looks, you know. So nowadays you get these teenagers wanting to come and get Invisalign done, align their teeth, all in a very young age. They are itself asking because there is so much concern about the looks. But the advice will be, also look into your teeth as not only for the aesthetic aspect but also the general health aspect, because good health starts from the mouth. And there are so many things that we can advise, but the main thing here is visiting a dentist. That can save a lot of problems, because an advice can be so many things, related to so many things, but one main factor is wherever you are, there will be a dentist. So just go and get a checkup done. Just find out if something is required, whether you're doing your brushing and everything properly. All that will help in the long run. That's the only advice I would give.
Thank you, doctor.
Thank you
for
so
those
much.
time.
Right.